Come, I know you are worried that your child is always bleeding from the nose, and you have searched everywhere. You can't even place your fingers on what may be responsible. Sometimes you wake up in the night and find your child, your 4-year-old, your 3-year-old bleeding from the nose, and probably you also experienced it when you were at that age. Yes. So let us look at it. It's good to know what may actually be causing it and what to do when it happens. Let's start by looking at what may actually be causing it. What may actually be causing nosebleed in children? Number one is trauma, injury. Our children are fond of putting their hands in their nose. I don't know about your children, but mine, there's this particular one. Her hand is always in the nose. And so because the nose has a lot of blood vessel, so that they are poking and poking and poking can cause injury to the nose. And this can lead to bleeding. And this is the commonest cause of bleeding in children. Now, the second reason may be due to allergy. And a child who has allergy will have runny nose, sneezing, itching of the ear, itching of the throat, itching, always having runny nose. Yes, allergy may be the reason. And that is why you may have noticed that this bleeding from the nose is commoner at a particular season of the year or at a particular time of the year, depending on what the allergens are, depending on what the child is reacting to. And this can be flowers, even pollens, dust, can even be your pets that is causing the allergy. Your dog, your cat may be the reason why your child is having allergy. So just look around your house and then get that sorted out. Now, another reason may be due to dry air, especially during harmattan, when everywhere is so dry. You find out that your child bleeds more at this time of the year. So harmattan, dry air could be a reason your child is bleeding. So begin to sort them out now and start ticking them. Okay, oh, it's not this, not this. So let's go to number 4 and find out if it may be due to number 4. If the child is having infection of the nose and infection of the airway, it can cause nosebleed. So we have listed 4 things now, and if you still have not figured it out, we are still going to number 5, which may be due to a growth in the nose. Even a growth at the back of the nose can cause bleeding. So that is another reason why your child may be bleeding. So at this point, I need to say something. If your child is above, at least it's up to 10 years, let's say from 10 years, it's getting to that teenage age, 10, 11 years, and you are noticing bleeding from the nose, please make sure that child is properly evaluated. There's a reason for that. Yes, don't just sleep over it. Make sure that child sees a specialist so that the child can be properly evaluated. Now we have listed 5 things. You should also check around, is the child on any drug? There's some drug that can cause bleeding. So just check your drug. Could it be a drug? Some class of drug can cause bleeding. Anticoagulant drugs can cause bleeding. Then is there any problem with bleeding in your family? Any other person bleeds? Does the father bleed? The father's siblings, paternal family, maternal family, anybody having problems of bleeding? That could also be a reason. Then there may not be any cause. Yes, there may not be any cause for that. Now, sit down and look at all the 7 things I have listed and make sure you see your doctor. So let's go to the next part of this discussion. What should you do when you notice your child is bleeding? In order to make this video very long, I'll be stopping here and continue in the next video. But make sure you like this video as we go into the next video to continue with this discussion.